Imagine carrying a life-threatening infection and never knowing it. No fever, no pain, no cough, no rash. Nothing to warn you that something inside your body is quietly dismantling your immune system. You feel fine, you look fine, and yet without realizing it, you may be living with HIV. This is the chilling truth. The most dangerous HIV patient often feels perfectly healthy. The silent spread of HIV is what makes it so deadly. Millions of people walk through life working, laughing, loving, all while carrying a virus that slowly eats away at their defenses. Many don't discover the truth until it's too late. When symptoms finally appear in the form of life-threatening infections, or even full-blown AIDS. But here's the good news. With the right knowledge, testing, and protection, HIV doesn't have to be a death sentence. In fact, if caught early and treated properly, people living with HIV can live long, healthy, and fulfilling lives. So in today's video, we're going to dive deep into the hidden world of asymptomatic HIV. We'll explore how HIV hides in the body for years without symptoms. The real-life stories of people who found out only by chance. Subtle signs and whispers from your body you should never ignore. Why early testing is crucial, even when you feel fine. How to protect yourself and your loved ones from silent transmission. The devastating consequences of delayed diagnosis. And the hope that comes with early treatment. Stay with me until the very end, because the knowledge you gain here could save your life, or someone else's. After initial exposure to HIV, some people may experience mild flu-like symptoms. But in many cases, there's nothing at all. Even if symptoms appear early, they often vanish, leading people to believe they're in the clear. What really happens is that HIV enters what's known as the clinical latency stage, or the asymptomatic phase. This phase can last anywhere from 2 years to over a decade. During this time, the virus is still actively replicating, quietly infecting crucial immune cells called CD4 cells. These cells are your body's soldiers, the frontline defense against disease. But here's the danger. You won't feel a thing. You can pass medical checkups. You can live a seemingly normal life. All the while, your immune system is slowly being dismantled. And even though you feel fine, you are still contagious. This is why HIV is often called the silent killer. Let's make this real with true-to-life cases. Sarah was 29 years old, healthy, energetic, and with no obvious risk factors. She went to donate blood for a friend. A couple of weeks later, she received a call. Her blood had tested positive for HIV. No symptoms, no warning signs. Only later did she discover that her boyfriend had cheated years before. By the time she found out, her immune system was already severely weakened. Then there's Jamal, 38 years old. He came in complaining of fatigue and a strange pneumonia. When tested, he was HIV positive. For years, he thought his tiredness was just a part of getting older. He had no idea his immune system was under attack. These stories are not rare. They're happening every single day. Millions are living with HIV without knowing it, and some only find out when it's dangerously late. Here's the hard truth. HIV can live in your body for years without showing a single symptom. The only way to know is through testing. Many people convince themselves with excuses. I don't feel sick, so I must be fine. My partner looks healthy, so I must be safe. I haven't done anything risky recently, so I'm not at risk. But HIV doesn't work like that. It's not a sudden illness. It's a slow, silent invader. The best time to test is 3 to 4 weeks after a potential exposure using an RNA or P24 antigen test. Again at 6 weeks. And for final confirmation at 3 months. Modern fourth-generation tests are extremely accurate and can detect HIV during the early window period, before standard antibody tests would show results. Don't wait for symptoms. By the time you feel them, the virus may already have progressed into advanced stages. HIV may not always scream, but it does whisper. The challenge is that these signs are easy to dismiss as everyday issues. Mild fatigue you blame on stress or poor sleep. Night sweats that seem annoying but not alarming. Small, random rashes that come and go. Recurring mouth ulcers you dismiss as accidental. Slight, unexplained weight loss. Swollen lymph nodes in the jaw, armpits, or groin. What makes this dangerous is that these symptoms often disappear as quickly as they arrive. You convince yourself it's nothing. Maybe stress, maybe diet, maybe just getting older. But these are your body's warning lights. Ignoring them allows the virus to dig deeper. So don't wait for your body to scream. Pay attention when it whispers. Since HIV doesn't always show visible signs, protection is about proactive choices, not blind trust. Here are the most effective steps you can take. Always use protection with new or multiple partners. Get tested together with your partner before stopping protection. Repeat testing every 3 to 6 months if you're sexually active with multiple partners. Understand that undetectable equals untransmittable. People living with HIV who take treatment consistently and maintain an undetectable viral load cannot pass on the virus sexually. Listen to your body. Don't ignore unexplained fatigue, mouth sores, rashes, or swollen glands. Trust alone isn't enough. In medicine, only testing tells the truth. When HIV is discovered late, the consequences are severe. Starting treatment with a weakened immune system makes recovery harder. The risk of opportunistic infections like tuberculosis, pneumonia, or cancer increases. The emotional toll of an unexpected diagnosis can be overwhelming. Worst of all, many people unknowingly pass HIV to others, believing they were safe. Late diagnosis doesn't just delay treatment. It changes lives forever. But let's not end with fear, because there is real, powerful hope. If HIV is detected early and treatment begins promptly, the outcome is dramatically different. With antiretroviral therapy, the virus can be controlled to the point where it becomes undetectable. And when it's undetectable, it's also untransmittable. That means a person can live a normal lifespan, healthy, active, and free of the constant threat of spreading the virus to others. HIV is no longer the death sentence it once was, but that hope only becomes reality if you know your status. Silence is the real killer, not the virus itself. If you're finding this information eye-opening and valuable, take a quick moment to subscribe to our channel. We share life-saving insights on health, wellness, and prevention. Content that can help you and your loved ones live stronger, healthier lives. Now that you know the truth about asymptomatic HIV, take action. Get tested, even if you feel fine. Encourage loved ones to test. Share this knowledge. You might save a life without even realizing it. Because HIV doesn't shout. It whispers until the damage is done. Don't give it that chance. And if you've watched this far, you're part of the solution. Thank you for being here, for caring about your health, and for caring about others. This is Dr. Alex with The Healthy Body. If you haven't already, subscribe to our channel for more science-based health insights designed to keep you informed and empowered. Together, we can fight misinformation, spread awareness, and protect the lives of people we love.